Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 41st episode of the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts, and today we have yet another fantastic question from a listener. Constance, let's listen in.
My question is, I have too much calcium in my urine, so the doctor put me on indapamide, low dose, to try to alleviate that so I don't have as many kidney stones or any more kidney stones. I had side effects from the indapamide and stopped taking it. Is there anything else I can do besides medication to help not have more kidney stones? I've had many and a number of procedures. Thank you for taking my question.
So first of all, Constance, I just wanted to say I'm so sorry to hear about your multiple kidney stones and multiple procedures to remove kidney stones. I can't imagine, and I'm so sorry that this is something that you've had to deal with throughout your, I imagine, majority of your life, or at least too many years, right? And I'm very happy that you're here and that you found me, and hopefully we can work together to figure out some ways to reduce your risk of stones. As you know, unfortunately, the quality of prevention that most people get with kidney stones, even when we've had multiple, if not hundreds of kidney stones in our life, is subpar, and that's why I do what I do. And so thank you so much for submitting that question, and I know that this question will help a lot of other listeners. I've actually gotten a handful of questions very similar to this in the last month or so submitted to the podcast. A lot of people have been asking, I've looked at my 24-hour urine test and I see that I have high urine calcium. That seems to be the thing that's most out of range. What can I do? The first thing I want to say is that you are not alone. If you are looking at your 24-hour urine test and you see that you have high urine calcium, that is by far the most common cause of kidney stones, whether it be calcium oxalate stones or calcium phosphate stones. It seems that high urine calcium is really what is driving kidney stone formation for most people. And that is one of the reasons why, one of the many reasons, but one of the big ones from a nutrition standpoint, why I'm so passionate about getting that 24-hour urine test, because so often the only advice people get for preventing stones is eat a low oxalate diet. Well, most of the time, people don't even have high urine oxalate. It's really that high urine calcium that's driving that stone formation. And also, even if you do have high urine oxalate, just simply eating enough calcium gets that urine oxalate down. But I digress. I've talked about that so many times on the podcast, and I have endless content about that on my blog. So if you're interested, definitely keep listening to the podcast, and those topics will come up. But for today, I really wanted to kind of hone in on high urine calcium and what we can do to get it down from a nutrition standpoint. So as Constance mentioned, she was put on a medication to get that that urine calcium down, which is very common. There's a group of diuretics called thiazide diuretics that are very effective typically at reducing urine calcium levels. So indapamide is the one that was mentioned, that Constance mentioned that she was put on, and that's super common for people with kidney stones. Some of the other ones that you may have heard of or maybe taking is a thiazide called chlorothiazide. There's also chlorothalidone and hydrochlorothiazide. I feel like those tend to be the most common ones, at least in my experience, that are prescribed to get that urine calcium down. Now, I'm not saying that we don't need to take medication. I think there is absolutely a time and place for medications, whether it be these thiazide diuretics to get urine calcium down or many other reasons to take medications. I think they are wonderful tools and make a lot of lives a whole lot better. However, I think what's unfortunate is that so often medications are the first line of treatment when if we look at urine calcium, especially if that urine calcium isn't crazy high, right? If that urine calcium is, say, 350 or less, it's really hard for me to say exactly how much because, you know, the ability for diet to get urine calcium down into normal range is going to vary very much on the person's ability to make the diet changes. It's going to vary very much on how high is, like, or how out of whack is their diet. Like, basically, how much room for improvement is there that we could work with to get that urine calcium down. So, you know, it's really hard for me to say, like, a cutoff of how high urine calcium can be before we can get it down with diet. But whatever it is, I just feel like 9.99 times out of 10, you know, people see high urine calcium, and people are prescribed a diuretic, which again is fine. But especially if the person really wants to stay away from that medication and there's room for improvement in their diet to make the changes that we're about to talk about to get that urine calcium down, that should be the first line of treatment. And then if that doesn't work or doesn't work enough to get calcium into a comfortable level, then I think utilizing these medications can be very, very helpful. So just wanted to kind of throw that out there, my thoughts about how these medications can fit into kidney stone prevention treatment plans, because I think they absolutely can and should for many people. But I think that nutrition needs to be given a whole lot more weight than it typically does. So we'll get to the good stuff now. So if you find that you have high urine calcium on your 24-hour urine test, the biggest tool that I have in my dietitian toolbox to help you get that urine calcium down is making sure that you're not eating too much salt. So the more salt we eat, it's practically a direct relationship. The more salt we eat, the more calcium is going to get excreted in our urine. It basically just has to do with the way the kidney handles sodium. When we eat salt, basically all that salt needs to come out in our urine. That's how our body processes it. And the way that it has to get rid of each of those sodium molecules is it also has to get rid of a calcium molecule, unfortunately. And so that is why we see higher urine calcium when people are eating too much salt or sodium. So as always, the goal is never, ever, 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 ever a zero salt diet. I actually recommend, and the American Urological Association also recommends no more than 2,300 milligrams of sodium per day. Sometimes you'll see it down to 1,500. I struggle with that recommendation because I find it a bit unrealistic for most people, and I kind of feel like it sets them up for failure, quite frankly. And I think that in my experience, if we can get sodium down to 2,300 milligrams, that is more than enough to get that urine calcium down into normal range, which ultimately is our goal. Also, the recommendation of 2,300 milligrams of sodium is also what's recommended for the general healthy eating, like, you know, the guidelines for Americans. So that is also going to be beneficial for like blood pressure control and preventing heart disease and kidney disease and stroke and all of those types of things. So really none of us should be eating a ton of salt. Most of us should be aiming for 2,300 milligrams of sodium per day anyway. But for people who have high urine calcium, that is even more important. Just as a quick side note, another great thing about getting a 24-hour urine test is that very often that urine test is going to measure how much sodium is in your urine. You can take that sodium amount in your urine. Typically that sodium is given in milliequivalents per day, and you can multiply that sodium in milliequivalents per day by 23, and that's going to tell you pretty much exactly how much salt you consumed that day in milligrams, because on food packages and nutrition world, we think about sodium in milligrams. In nephrology world and urology world, they think about it in milliequivalents. So we need to kind of translate that sodium into normal people language, which is milligrams, in order to kind of put that into context for us. So since our goal for sodium intake is 2,300 milligrams per day, if you have a milliequivalent sodium in your 24-hour urine test that is 100 milliequivalents, that is the same as 2,300 milligrams. So if you see that your urine sodium is, say, 200, 250 milliequivalents of sodium per day, which is not abnormal, I have seen probably hundreds of urine tests with sodiums of that high, that indicates that you're eating twice or more than double the amount of sodium that you should be eating per day. I wanted to really highlight this because I think so often we don't realize how much salt we're eating because salt is so sneaky. I have a previous kidney stone nutrition school student who calls it stealth sodium. Jim, he was actually on the podcast in one of the earlier episodes. And I love that term because it really is so sneaky. Even foods that don't seem, quote, salty are huge sources of sodium in the diet. And the first one that just came to mind right now is bread. Bread doesn't taste salty, right? We don't think of bread as salty, but there's a fair amount of sodium in it. And because we tend to eat so much bread, because it's delicious, that bread is actually one of the biggest contributors of sodium to the American diet. So just wanted to throw that out there, that if you do have a urine test, one benefit is to check in with yourself to see how much salt you are actually eating. And you want to take that sodium in milliequivalents, multiply it by 23, and that's going to give you milligrams of sodium per day. So the biggest thing we can do to get that urine calcium down, long story short, is eat the right amount of sodium. And then there are 3 other recommendations that I have sort of in decreasing importance, but just wanted to mention them because sodium is definitely the most important one. But also when we eat too much non-dairy animal protein, that can also cause urine calcium to rise. Actually, just in the previous episode, in episode number 40, I went into deep detail about non-dairy animal protein and how much we should be consuming and exactly what non-dairy animal protein means. But just know that if you are eating excess or too much non-dairy animal protein, that's another big reason that I see high urine calcium levels on 24-hour urine tests. The next thing to look at if you do have high urine calcium is actually added sugar. This is, I put last on my sort of top recommendations just because the research isn't quite as strong in this area, but we do definitely see that people who eat a lot of added sugar tend to have higher urine calciums, and there's definitely a correlation between eating a lot of added sugar and kidney stone formation, most notably from sugary drinks, so things like, regular soda, sweet tea, lots of fruit juice, fruit punch, any of those drinks that have a ton of sugar. So if you do find that you have high urine calcium, I do think it makes sense to kind of dive into your added sugar intake and make sure that it isn't too much. As always, a little added sugar is completely okay. I am absolutely not saying that you could never have cookies again. What kind of life would that look like? What kind of life would that be? That would be miserable. Some sugar is totally fine. It's just when we're eating a ton of it all the time that it tends to be a problem. I talked all about added sugar in episode 31 of this podcast, how much added sugar is okay, because I had another listener question about that, exactly how much added sugar is okay. So definitely check that episode out if that's something that you are interested in learning a little bit more about. And my last recommendation for you, if you have high urine calcium, is to make sure that you aren't taking any calcium supplements. So this is a very nuanced thing, so listen up, because you might be very confused, because I'm sure you've heard me and hopefully lots of other people tell you that eating lots of calcium is good for calcium oxalate kidney stones and also calcium phosphate stones, for the record. And one of the reasons that we say that we want to eat a lot of calcium from food is that it lowers how much oxalate is absorbed in our intestines. And in general, people who eat calcium-rich foods tend to have a lower risk of kidney stones by quite a bit. And so eating enough calcium is really important. However, we see that in some studies that taking calcium in supplemental form, so taking calcium pills, this includes Tums, all of these sources of calcium are actually associated with a higher risk of kidney stones. We think that the reason is that calcium supplements raise urine calcium levels a whole lot more than eating calcium from food does. And so while it's really, really important to get enough calcium for people with calcium stones, to help reduce the amount of oxalate that's absorbed in your intestines, and also for your bones, because people who have calcium stones are at much higher risk of osteopenia and bone fractures and these types of things. So getting in that calcium is critical, but whenever possible, we really want to get that from calcium foods rather than calcium supplements for most people, just because we do see a higher risk of kidney stones for people who take calcium supplements. Now, that being said, there's no one-size-fits-all advice here. There are definitely some groups of people who benefit from taking calcium supplements for kidney stones. So the first group of people that comes to mind is people who have kidney stones as a result of of bariatric surgery. People who have had bariatric surgery and who are having kidney stones are making kidney stones for a very different reason. The pathophysiology of why they're making stones is very, very different than people who are sort of more generically making kidney stones. And their urine calcium typically isn't high. And so in that instance, I do think that calcium supplements can absolutely be utilized and can be super, super helpful. But for most people, and especially since this episode is about getting urine calcium down, we really want to avoid calcium supplements whenever possible. The obvious next question, a question that I get all the time, is what about calcium supplemented foods or food products, right? So things like calcium fortified orange juice or any of the plant milks are going to be fortified in calcium as well, because no like, almonds or rice or coconut or hemp, like any of the plant-based milks are not naturally high in calcium. All of them are fortified to be more equivalent to cow's milk calcium. And the data isn't super clear here. And so this is even more individualized and a little bit more gray than what I'm typically talking about. So we don't really know if the calcium fortified products are different in terms of impacting urine calcium versus natural calcium versus calcium supplements. The data, just as far as I know, isn't that advanced yet. Maybe one day, but right now we just kind of have to work with our experience. In my experience, most of the time, these calcium fortified products don't raise urine calcium like I see those increases with actual calcium supplemental pills. However, I have a handful of times seen high urine calcium from people who are using these plant-based milk products or, calcium fortified orange juice or something like that. And it does go back down after we sort of temper that and get a little bit more natural calcium, if you will. So my jury on these calcium fortified products is sort of wishy-washy. It's, I'm not really sure exactly what to do with them. I will say that calcium is so darn important for people with calcium stones. I need you to be getting that in, even if it has to be from plant-based milks. Dairy is always kind of my number one recommendation. But I fully understand that not everyone tolerates dairy or maybe avoids dairy for ethical reasons or religious reasons. And I obviously completely respect that. In that case, my sort of next recommendation is plant-based milks. But we do have to kind of be careful of that urine calcium and kind of watch it to make sure that it's not jumping. And if I do see high urine calcium and everything else is good, right? We're not eating too much protein. We're not eating too much sodium. We're not taking calcium pills. Maybe we'd have to tweak a little bit with those calcium fortified products. But again, this is getting super individualized and really individual to each person. For most people, taking those fortified products is completely fine. So, Constance, I hope that helps you understand a little bit more about what you can do to get that urine calcium down. If you are trying to get off medication or stop from starting medication in the first place, my recommendation is to work with your doctor and say like, hey, I'd really love to avoid this medication. Is it okay if we try diet and lifestyle first? So what I'd recommend is to not be on medication for maybe 2 or 3 months, work on all the changes we just talked about. If you want more help with this type of thing, this is exactly what we talk about in Kidney Stone Nutrition School, talking a little bit more about the specifics for you and talking a little bit more about how to actually make these changes. But anyway, make those changes and then get another 24-hour urine test and see how that urine calcium falls. If it has come down beautifully and you're feeling good and you feel like this diet is something that you can do for a long time, that's wonderful. Then there really isn't a need for that medication. But if you find that this is not something that you feel like you can do long term, or we don't see that urine calcium come down enough, then I think that there's absolutely a time and place for medication, and there's absolutely no shame in taking medication for kidney stones or for any other medical condition. So I hope that was helpful for you, Constance, and for the many, many others of you that have submitted questions about high urine calcium. I want to end by thanking you for joining me for this episode of the Eat Away Kidney Stones podcast. And also a huge favor, if you are listening to this podcast and you're really enjoying it, if you could take 1 minute and leave a review for the Eat Away Kidney Stones podcast on whatever platform you listen to your podcasts on. It is hugely helpful. It is a wonderful way to support any small business, including myself. It really helps my podcast get ranked, and it helps me be able to help more people prevent kidney stones. So again, that would be a huge favor to me if you could leave a review. And thank you again so much for joining me, and I cannot wait for you to join me next week on the podcast. Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.